Hello and welcome to our podcast series. My name is Meghann Drella and I'm a Senior Solutions Manager here at Outsource Strategies International. Today I will be discussing 5 common conditions chiropractors treat and their ICD-10 codes. Chiropractors who diagnose and treat different disorders that cause musculoskeletal or nerve pain need to document various procedures such as spinal manipulation or other manual therapies. Billing and coding different disorders of the musculoskeletal and nervous system can be challenging. Physician practices need to use the correct ICD-10 codes to report these disorders. I'll now be giving you a closer look at the 5 common conditions that chiropractors treat. Carpal tunnel syndrome refers to the painful condition caused by pressure on the median nerve in the wrist. The median nerve passes through the carpal tunnel, a narrow passageway in the wrist, and goes into the hand. The median nerve also controls the muscles at the base of the thumb. The abnormal pressure on the nerve can result in pain, numbness, tingling, and weakness in the hand. In most cases, this pressure develops when the tissues around the median nerve of the hand swell and press on the nerve. If this is left untreated, the condition can lead to weakness and lack of coordination in the fingers and the thumb. The next would be migraine headaches. This type of headache that occurs due to specific changes within the brain. The condition causes severe head pain that is often accompanied by sensitivity to light, sound, smell, or physical movement. The pain, often described as throbbing or pulsing, usually begins on one side of the head and typically lasts from 4 hours up to 3 days. According to reports from the National Headache Foundation, about 47% of adults in the United States experience some form of migraine and headaches each year, and it affects 3 times as many women as men. Medications can help prevent some headaches and make them less painful. However, the correct combination of medicines along with self-help remedies and lifestyle changes may help prevent the occurrence of pain. Tennis elbow, also called lateral epicondylitis. Tennis elbow occurs when the tendons in the elbow are overloaded, usually by repetitive motions of the wrist and arm. The repeated movements may result in a series of tiny tears in the tendons that attach the forearm muscles to the bony prominence at the outside of the elbow. The condition causes pain and inflammation around the outside of the elbow. Common symptoms include wrist weakness, chronic pain when lifting or bending the arm, difficulty in extending the forearm fully, pain and stiffness when fully extending the arm, pain when lifting and carrying, and tenderness outside the elbow. As the name suggests, playing tennis sport is one of the prominent causes of this condition. However, many other common arm motions such as using plumbing tools, driving screws, repetitive use of computer mouse, playing some type of musical instrument, and painting can cause tennis elbow. For the majority of patients, tennis elbow is treated non-surgically to relieve pain and weakness associated with the condition. A whiplash injury, also called a neck sprain or a neck strain. A whiplash injury refers to an injury that occurs when the soft tissue in the neck becomes strained, stretched, and damaged. The injury occurs due to forceful, rapid back and forth movement of the neck. In most cases, the condition is caused by a rear-end collision. The sudden impact causes speedy movement of the structures within the neck and changes the normal curve of the upper back and neck. The primary symptom of whiplash is neck or upper back pain. Signs and symptoms usually develop within 24 hours of the injury. Other related symptoms include loss of range of motion in the neck, fatigue, and dizziness, worsening pain with high neck movement, headache, and tightness or spasms of the muscles in the neck and upper back area. Treatment modalities include chiropractic care, physical therapy, epidural steroid injections, and medications. Treatment options may vary from person to person and depend on the type and severity of the injury. Lastly is osteoarthritis. Regarded as one of the most common chronic joint conditions, osteoarthritis causes pain, swelling, stiffness, and difficulty moving the joint. Also called degenerative joint disease, wear and tear arthritis. The condition occurs when the protective cartilage at the end of your joint breaks down and causes the bones to rub against each other. The condition primarily affects the knees and could also affect the fingers, thumbs, spine, and hips. Even though this condition can occur in adults at any age, it's often seen in older adults. In fact, the likelihood of developing osteoarthritis symptoms increases between the ages of 55 and 64. Joint pain is one of the primary symptoms of this degenerative joint disease. Treatment modalities for this condition include therapeutic techniques combined with medications. These are the 5 common conditions chiropractors treat. Chiropractors must have a thorough knowledge of all of these 5 conditions and their highly specific ICD-10 codes. I've attached an article with a list of all the codes discussed in today's podcast. I hope this helps, but always remember that documentation, as well as a thorough knowledge of payer regulations and guidelines, is critical to ensure accurate reimbursement for the procedures performed. Thank you so much for joining me, and stay tuned for my next podcast.